Wes Streeting, thanks for coming in. You said when you were asked about a big reorganisation back in December 2023, and I quote, "I don't feel the need to come in and make my mark on the system through a big top-down reorganisation." Now, I think you've changed your mind rightly, but what was it that made you change your mind?
Experience of the last 8 months, to be honest, Andrew. I mean, I came in, I knew that there needed to be a change in approach. So I came in, and with Amanda Pritchard, who's the outgoing chief exec of NHS England, we've worked together to build what I've described with Amanda as a one-team culture across the department and NHS England to try and get rid of some of the duplication, waste, inefficiency and contradiction at the kind of the national level that then bleeds down and fires all sorts of competing instructions in. However, I mean, just to give people a sense of scale, the combined size of my department at NHS England is twice as large as it was in 2010 when Labour was delivering the shortest waiting times and the highest patient satisfaction in history. So we are paying more, getting less. So what the Prime Minister and I are announcing today is about better outcomes for patients and better value for taxpayers.
So when you looked at the reorganisation, all the rest of it, you thought, hold on a second, it is bonkers having two big organisations both trying to run the NHS.
Yeah.
What was the moment that made you realise that?
I think when you actually sort of work in that system, despite the fact that across both organisations there are some brilliant people. So this is not about saying, oh, because I mean, the bureaucracy is definitely bloated. But that doesn't mean the people are a waste or bloated or not hard-working, because they really are. And I know that this sort of change is unsettling for people, and that actually weighs heavily on me because I like people that I've worked with and who work for me. But I think the challenge here is that, you know, especially thinking about the last few months, I reflected on this over Christmas. I sort of came back in the new year, and at that stage was talking to the NHS's leadership, talking to the Prime Minister, saying something's got to change. And one of the things that's made this possible is having the backing of the Prime Minister's leadership. I mean, he says he wants to modernise the way that Whitehall works. My goodness, it needs it. He says he wants to cut the number of quangos, and today we're abolishing the biggest quango in the world.
There are still 300 quangos or so through which the government channels public money. What's next? Have you got a list of quangos you want to take out beyond this one?
We're definitely going to be doing some reform of regulation. One of the complaints I hear from frontline leaders in the NHS is, firstly, they didn't like the duplication and contradiction you sometimes get from the head offices, and the fact there's two head offices, bonkers, so now there'll be one. But they also say, look, we know there's a tough challenge, we know we've got to reform, but actually it's the weight of regulation that's determining lots of decisions which are leading to waste, inefficiency and poorer patient outcomes. So you, Secretary of State, need to set us free to deliver. So there'll be more regulatory reform. And I am looking at all of our arm's length bodies and saying, can we get even more efficiency? Because, to be honest, Andrew, even if the country weren't in the massive hole it's in, and the public finances weren't in the massive mess that they were left in by the Conservatives, I think we would still be and should still be doing these things, because at all times we should be delivering good value for taxpayers' money and spending it as carefully and as wisely as they're spending their own money.
Now, I know you'll say this is not about job cuts, but nonetheless, for an awful lot of people listening, the numbers of people being shed will be very important indeed. You've said get rid of about half of the office staff in the Department of Health and NHS England within 2 years. Now, my back-of-an-envelope calculation means that's between 9,000 and 10,000 people. Is that about right?
That's broadly right, and that will save hundreds of millions of pounds a year. And although abolishing NHS England will take place over a 2-year period, we will go as fast as we can on that restructure of staff so that we can generate savings as quickly as possible.